putting it on and thinking like a researcher, I was like, there are so many applications we could use this for health, and connecting with people. Like outside, I think at the time everyone was thinking about games, but my brain immediately went to obviously games, but games for a purpose. Like, how can we help people with this? So that was my first exposure. I met a lot of people there at that conference and joined Oculus Launchpad the year later, which really exposed me a lot more to VR and AR. And then from there, just kind of kept pushing forward to see how I could get involved. And then met this guy over here, and the rest is history, I guess.
Yeah, Kim, I never heard that story, Kim. That's awesome. So my entry into VR was actually through an organization called Game Changer. This is an organization that I got in touch with around, I don't know, it must have been around 2017. It was about the time that the Oculus Rift was released. I had not had an opportunity to try it, but this org kind of came to our hospital, and being the only kind of tech guru, I guess, in the section, I met with them and was just talking about all the exciting things I thought could be done with gaming in general, and then VR specifically. And at that point, the org was kind enough to send me an Alienware desktop and an Oculus Rift. And I went in it one day in my office after setting up, and it was just like, wow, this is making me rethink everything we do and rethink about, how we can deliver medicine. And I didn't know exactly what I was going to do at that point, but I was leading the charge to address adolescents and young adults with cancer and improving their care. And it seemed like an obvious solution to start support groups. And then it turned out not so obvious that these patients did not want to come back to the hospital, did not want to do these things during Zoom, did not necessarily want to be seen. Around that time, the Oculus Quest was starting to be discussed, and it became clear that pretty soon VR would be able to be portable in homes without giant setups with cameras. So went through all the proper channels, which is a beast to do at a place like Yale when you want to do real research. The IRB, the Protocol Review Committee, wrote up a protocol that went from about 6 pages to 32 pages, thinking about safety and ease of use and proper scientific design. Finally launched that pilot, and serendipitously met Kim at a conference just at the turn of COVID at Vanderbilt, where I also actually met Noah at that same conference. So a week before kind of COVID shut down the country, the three of us all met. And from there, I told Kim she's got to get out of internal medicine, come to pediatrics. Dragged her, I wouldn't say kicking and screaming. I think it was a good transition. And we started working together, and it's been a great partnership ever since.
Amazing. Yeah, it's that was 1 week before COVID shut down. We had a VR conference, so glad that was able to work out. And yeah, it's really cool to hear. I think a lot of people, once they try virtual reality and experience it and realize the potential, it's so cool to see all the different ideas that come. Especially that for academics, both of you have been doing research for many years before you tried virtual reality. And then all of a sudden it unlocks this whole realm of possibility. And I feel like now, as the Quest has come out and it's gotten easier, and I'm sure people here have shown their friends, their family, virtual reality, it's this mind-blowing moment, and then people start to realize what's possible. Or now there's this whole thing, I guess VR is being rebranded as spatial computing, even though it's been around for a while. But yes, so whatever you call it, it's still the same incredible thing. And so now I kind of want to dive into the first project that we're going to talk about. So Kim, you have a really interesting application called Invite Only. So I'm kind of curious if you could describe the application, and then I'll just kind of ask you a few more questions about it. Maybe you should give an overview of what the application does and how you had the idea to create it.
Absolutely. It kind of ties in to what I was talking about before. I was at a conference. At the time, it was the CFO of Oculus, and we were talking about, I was like, I see so many applications for health in this. And he was like, I'm wanting to start like an Oculus education kind of section, right? Or role at Oculus. And no joke, he set it up. And like, I think a year later was like, hey, what can you create, like education or health based for teens? Like, what can you come up with? And at the time, so that was like great. It was just a perfect, awesome lead in to have like an industry give you a ton of money and say, go figure out something to create and bring it to schools and see if kids will play it. Um, and at the time, it was the Gear VR. Do you guys remember that, where you had to put your phone inside the case? Yeah, everybody, a lot of people remember that. It was horrible. I mean, it worked, but it didn't work, right? It was like a great introduction to it, but your phone would overheat really fast, and if you're for any reason, if anybody texts you or you got something popped up on your phone, the application would go out. It was such a mess. And could you imagine like trying to bring that into schools? Like in my head, I knew it was never going to work. Like there's no way teachers are going to adopt this because it's just, and it was expensive. Those headsets weren't. You could get those for $50, but you had to have the Samsung expensive phone to go in it. So anyway, we decided after a lot of discussion to focus on vaping. This is like 2017, 2018, right? When vaping was just, Juul was a huge thing, and it was becoming a real issue with teens. Schools were not aware of what was happening, so kids were able to hide it, and it was highly, highly addictive. So we decided to focus the game on vaping. And we created, it was a 2-hour intervention. It was focused on kids 11 to 13 because you always want to try to get to kids early before they're actually engaging behaviors. So we went to middle schools and we brought it to about 300 kids in Connecticut, in Milford, Connecticut. And it was just the most amazing experience ever. We had, from then, we'd been able to put it on the Oculus Go, which I don't know if you guys remember that. That was like several Meta Quests and Oculus devices back, but it was a great headset. And I was like, the first time I was so excited. So I was like, oh my gosh, yes, we could get this into schools. $150 for a headset, and they were perfect. You had to sit while you were playing it. It wasn't too complicated. The UI UX was perfect. You could just jump right in. So yeah, the whole goal of that, and I can I'll talk more about this later, Noah, but kind of sway into the, why we chose to focus on mental health on this new game. But we did that. We created a vaping prevention. It's a true game, as in you have a narrative. You play a character. Your whole goal is to try to get to this party at the that's happening on Friday. But you have to. You're only a freshman. It's a senior party. The girl you like's going to be there, right? So you have to kind of navigate some sticky situations to get this invite from the senior who vapes in the bathroom, right? So that's how you kind of put yourself in kind of these situations to kind of stay, like refuse risky situations, but also save face, like giving kids ways to practice getting out of situations they don't want to be in. But in a way that, it's not just say no, but like, I got a cold. I don't want to give you my germs, or the things that practice after, football practice after, like trying a bunch of different things. So yeah, that was the intervention. I'm really proud of it. When I look back now, it's really kind of goofy because the avatars are so creepy, but we've come a long way. But yeah.
Yeah, yeah, I think it's incredible. I mean, I remember talking to you before, and I mean, two things. One, the DARE program of just say no to drugs, we know doesn't work. It's interesting because there's an example that was built, wasn't actually tested scientifically through randomization, and so you don't know that, okay, this is actually going to lead to outcomes that we actually want of people not engaging in drugs. And people thought it worked, and then it was distributed across all these schools, and it turns out it actually doesn't. And so this more nuanced approach of actually putting someone in those social situations where they're pressured into vaping, was really, really interesting. And I think it seems more effective. And I know you've done randomized control trials to actually evaluate the outcomes. So I'm wondering if you can talk about that. And also, maybe you could just educate folks here, because I didn't realize till I talked to you the extent of this problem. And I know that obviously, like one hit of for example, Juul vape is equal to an entire cigarette's worth of nicotine. One puff on it equals an entire cigarette's worth of nicotine. But can you just maybe touch on the prevalence of this in adolescents, and then afterwards kind of how it works as well?
Right. Yeah. So vaping is a huge problem. And we've actually e-cigarettes are still huge. They're like a problem. At least 50% of kids by the end of high school have vaped, right? Um, and they are immediately addictive. They're really, really they're high, like full of nicotine. Um, Most vapes now that kids are using you don't have any idea what the percentage of nicotine is. Even if it says something on it, it's likely not true. Even if it says it has no nicotine, that's probably likely not real. And the way that it's delivered too, it just has a greater impact quicker on the lungs with the vaping for a lot of like a little some scientific reasons, I guess. I've since forgotten, but I do know that it impacts kids quicker, faster, and harder. So kids are getting addicted very quickly. Um, we've now had to adapt the game to include marijuana vaping. Marijuana is now legal in Connecticut.
Mm.
And so it's this is the biggest problem that teachers are having. They're seeing cannabis vaping and then uh, e-cigarettes, e-cigarette vaping, and then a combination of the both too. So we call it like co-use. So they're using both nicotine and cannabis. Um, and when the schools, the problem is too, teachers can't tell like which one it is. They're highly flavored. They're covered, like especially if you get caught with a vape in your pocket, right, or
Mm.
in your bag or something. They don't know what it is, so they don't know how to kind of I don't know, any punitive with kids. Like they don't know how to handle that. Kids, are safer to say it's nicotine than cannabis, so they don't get us in much trouble. But it's a big mess. And they're seeing it. Teachers are asking us to come in as early as fifth and sixth grade because it's middle school is a major, major, major problem. Um, yeah, so we did a large trial we had about 300 kids. I think it was like 292, and then that we did. But what we did was the entire school had like their kind of their prevention. They had somebody come in and give an hour-long seminar to the school talking about vaping prevention, and that was kind of their standard, right? That's the approach they took, which is fine. We know that brief interventions can be powerful, right? I'm sure the kids got a lot out of that. But on top of that, so we enrolled 300 kids, but half of those kids played the game, and the other half just got the standard, we call it standard of care, right? They saw the seminar. And we saw some major changes, like those psychosocial variables, or what we call it, like their knowledge increased, their harm perceptions, belief that nicotine and marijuana is dangerous. We were able to get kids to really understand that it is quite dangerous, it is quite addictive. Their attitudes towards vaping, their intentions towards vaping, we were able to change a lot of. We compared it to the kids that just saw this kind of 1 hour seminar. So VR is really, really, really powerful. And I think for us too, some of the very like just normal things that you wouldn't think about, like having a kid in a headset, right? They're closed off from the rest of the classroom to the kids next to them. They can't access their phone. They can't open other browsers, right? And we had just the game loaded on the headset, so they had nothing else to do but play our game. So VR, the hardware itself was really quite powerful because we had like a captured audience. Um, so I'd say that was probably one of the greatest things. And since it was a game and we kept it light and humorous and fun, and it was wrapped around this meta kind of game called Space Cats, where they could shoot space robot cats, right? From a shuttle. So it was a fun, engaging tool. Kids really enjoyed it, and I think that's where we won. We had almost nearly 100% of kids finished a 2 hour intervention, which is amazing. Like just being able to get them to
Wow.
play it and finish it in 2 hours too. So I'm really proud of it. I'm really proud of what we did, and we're continuing to move forward and create this new intervention. We're now funded by the Department of Public Health in Connecticut, and we'll be bringing it to 3 school districts with the marijuana focus, but then we're also bringing in mental health promotion, emotion regulation, and coping skills, because we've realized that most kids, right, that are using drugs, there's a mental health component to it. They're using it as a
Mm.
way to cope with stress or cope with anxiety or depression or things going on at home. And before we've never really kind of tackled that. We talk about like don't do drugs, they're bad, and these are all the health things that will happen if you smoke. But we're not talking about why. Like why are you choosing to vape or thinking about vaping? What does it do for you? And how can we think about this in a different way? A more, more healthier coping, right? And think about how to regulate your emotions and because emotions aren't bad, right? We want to really emphasize that to young people, like just how do we regulate them and make them work for us? So
Wow.
yeah, that's what we're doing now.
Amazing. And we had a question that I just heard about from in the YouTube channel where we're live streaming about, and we'll get to questions in a second from the audience about the what the name of the app is called and if it's available to download, for people at home and things like that.
Not quite yet. We should have it done by this summer, and the goal is to make it free access and put it up on the Quest store. We have a good relationship with Meta, so we're hoping. But I know Noah, with your experience, we should talk. It's going to be
Yeah.
hard, but our goal is to make this fully and accessible and free, probably by this summer.
Amazing. It's called Invite Only, is the application. And yeah, and I think, I just want to mention, I think the relationship of, I would be remiss not to just quickly mention the cognitive behavioral model here, because I think the connection amongst physiology, and I'll just move this maybe a little closer to folks, but like, we all know that the circle is the environment, or we might all, not all know, sorry. The model says the circle is the environment. We have thoughts, feelings, behaviors, and physiology that are all connected to each other. And what we think affects what we feel and what we do, and vice versa, and our physiology. And so vaping and using, nicotine is an input to our physiological body, and that affect our feelings and our thoughts and our behaviors and things like that. So I think that, if someone's feeling anxious or guilty or depressed or ashamed, and they use they have that physiological stimulus of nicotine and relieve that craving and things like that, that has an effect on anxiety, and then it can kind of, scalpel on top of that. So I think it's really great that you are focused on emotion regulation as a key component of substance use, and trying to help folks kind of overcome that as well. And yeah, so maybe we can open it up to the audience. If anyone has a few specific questions, maybe like 3 or 4 questions we can get to, and then we will switch over to the second part of our discussion about some of Asher's work as well. So yeah, does anyone have any questions for Kim about her work or what she's doing and everything? Yeah, Lemonade.
Hi. So I have an autistic kid. She just turned 6. I was wondering if you have any you know, programs to that would include them. So I'm just curious.
That is a great question. Asher and I have been working on this kind of really painful scoping review for the last year and a half now, which looks at all the studies that have been done in VR, AR, and with kids. And one
Wow.
of the most studied areas is autism. VR, XR, AR, like it just has some amazing applications for kids with autism. So our lab does not. We don't pretend to be experts in autism. And also, too, we like thinking of all the things we wanted to do in our lab. We were like, we're going to leave this to the experts that know how to do this well. That being said, I mean, if you have like, I would Google and look into it because, like I said, it's probably one of the most researched areas, and they are doing amazing, amazing work with the use of VR for treatment of autism, and mostly around like social skill
hmm
building, practicing social skills. That's probably one of the biggest ways it's being used, I would think. That right, Asher?
Yeah, yeah. A lot of it's, and I'll talk about this a little bit when I talk about the support groups. There's something about being able to kind of be represented without it actually being yourself that really cuts down some barriers to learning those social skills and interactions that just make things easier. So yeah, a lot of it was that social component.
Fantastic. Thank
Thank
you.
you.
Thank you both. Yeah, thanks for the question. I think the next 3 questions, and then we'll get to the next topic. So if anyone else has a question, we'll be able to get to towards the end. Yeah, Iniquis.
Yeah, I was just wondering if there's any like specific research about gaming you've been able to reference for any of this? Because like when I was in school, I remember there being uh, studies about how specifically 3D games, not VR yet, because it was way before VR became mainstream, um, affected mood and ability for to incorporate it into therapy, as well as I had personal experience with an internship, the same kind of work. So I was wondering if there what you've been able to reference for anything that you've been doing.
Oh, how long do you have? Oh my gosh. So, do we have any gamers here? Any? Oh, yeah, we've got some gamers. Yeah, yes, a lot of gamers. So, first thing I always tell people when they come into our lab, right, especially if they're not gamers, but they're really interested in games and the stuff we do, is play a lot of games. Doesn't matter what you play, right? Just play. The pediatrician, but and thinks what he thinks. But I think kids these days. We used to think it was up to 18. Now it's 25. Now it's maybe even up to 30 when we think of youth or young people, right? Or adolescents, even, right? But for this game, we're focused on 11 to 13, maybe even 10 to 13. Now that Meta has reduced their age to, for VR use to 10, we're feeling we feel confident that we can bring it to age 10. We do have a lot of thoughts about putting kids in VR too early, and we can talk about that at the end. But for this game, we're focusing on middle school. We're really based it on what teachers and schools and parents have told us, and they're saying start as early as 5th and 6th grade. So for us, that's around 10 or 11 that we feel comfortable enough to put them in VR.
That's perfect age for my little boy. Thank you.
Thank
Yeah,
you.
it's interesting to hear. There sounds like a lot of interest in folks having their own children go through this. So I think once you do launch on the store, I think that would be really, really powerful. And especially because I've always said that, like, once you have headsets, you can have, once a parent has a headset, all of a sudden they have this portal for an intervention for their child to use at home as well. Like, even if their child, put them in that app specifically, what's to lose if it shows that it could help for them prevent from experiencing harm. So I think it's really powerful. Yeah, and then Asher, any other thoughts on kind of what defines being a child and adolescence and things like that?
Yeah, I mean it's a tough one. I would say it's not age, right? I mean when we treat our adolescents, there's a there's a strict NCI definition of adolescent young adult goes from 15 to 39 in the cancer world. Some would say 13 to 18 is adolescence. But those are arbitrary numbers, and kids all develop and mature at different rates. So, I don't like to put specific numbers on it. I think I'm happy to put kind of a lower limit and be conservative with it. And as Kim was saying, the headsets have certain ages that they recommend. And I think one of the topics we're going to touch on a little bit is really putting younger kids into it, and the issues, not necessarily the biologic, the head size and the screen close to the eyes, but it comes down to their sense of reality, what's real, what's not, and then being able to differentiate between the two. And you immerse them, and that becomes all the more difficult. So it's something that Kim and I are kind of really interested in. How young is too young? But it's really about the content, not the technology.
Interesting. Yeah, and we'll get to this really interesting, and that's going to be our third segment, is about these, children's perception of VR and reality, and really being careful about the experiences that we make and the impact on mental health. So thank you, Asher. And our last question before we switch to Asher's work from Ostensible Muse.
Yeah, so I have a daughter that's about to turn 9, and she's already diagnosed with adjustment disorder, ADHD, oppositional defiance disorder, and social anxiety. And I'm trying to figure out how, like, if there's any data on how well this would work. She has a big problem with emotion regulation, and how well this works with any of those disorders.
Oh, that's a great question. I would say, I haven't seen a lot of stuff out there around emotion regulation in VR, where it's like a game-based, like skill practice. So we're kind of having to start from the bottom up, even ourselves, to try to figure out how this looks. But so I don't know. I don't know if there's any data yet. We do know that kids that score higher in emotion regulation skills, right, tend to do better overall. So that's kind of what we're trying to do, is help kids get that edge. But we don't know that because we haven't seen the data. And I will be honest too, we've brought this our idea to the NIH. I think this will be our fourth time that we've submitted an application saying, hey, it's emotion regulation is where it's at, right? Like talking about mental health early, promoting mental health early, and healthy coping and health. Do this very, very early. And they're like, there's no data. We don't have any data yet to show this. And we're like, exactly, because people just haven't been thinking about emotion regulation skills and, substance use prevention. So maybe this fourth time somebody will have heard us, but I'm sorry that I don't have any data to tell you to support this, but I feel like it's an obvious thing. We just need the data to catch up. So there, I know that there's some good apps, like like I don't know how your daughter is with like iPads, but I've seen some good apps that with emotion regulation, skill building.
Great. Yeah. Thank you, Kim. And yeah, it's really, I think it's interesting because we have a lot of adolescents and children struggling with mental health. And, we have a lot of different issues, substance use. There's a suicide crisis as well happening. And so when we talk about emotion regulation and all these other kinds of skills, I think those are so important for preventing downstream all these serious adverse outcomes that we're seeing in mortality. And so I think that, connecting prevention to some of the crises that we're observing is really, really important. And I think that it's really great work that you're doing to try to catch folks downstream, both from, substance use perspective. And also, by the way, one thing we haven't mentioned yet is the risk of, using nicotine early has a higher risk propensity for things like opioids and other substances in the future. So you're really working at the prevention level. And I think that if you're able to do that from an emotion regulation standpoint, it would be really powerful as well. So that's really fantastic. And so now we've just in case anyone tuned in a little bit later, we're talking with two experts from Yale University, from the Center for XR Pediatrics. And we are we talked to Kim about her app Invite Only that's focused on substance use prevention, specifically vaping, and also I didn't even realize marijuana was also included, which I think is really fantastic. And now our second part out of three parts is going to be, we have about 45 minutes left, is going to be Asher talking about his work in pediatric oncology with using virtual reality for support groups. So I'm curious if you could kind of describe a little bit of how you got into this work. How did you think about this as a possibility, and then kind of what you've been doing so far with your patients?
Yeah, no, thanks, Noah. I appreciate it. Excited to talk about it. So I really came to it to be honest as a solution to a problem that we had, which I always kind of push. It's important that when you're using new technologies, VR being the one we're talking about now, thinking about why am I using this? What's the benefit here? And we were in a situation where it seems pretty clear from not only anecdotes from our patients, but also from some good research, that adolescents and young adults with cancer were looking to connect with other adolescents and young adults with cancer. They were kind of this lost population where they would either walk into the pediatric center and be surrounded by a bunch of 3 and 4 year olds with leukemia, or walk into the adult center and be surrounded by a bunch of men with prostate cancer or older women with breast cancer, and they just didn't fit anywhere. And so, we, as an oncologist, I'm tasked with curing cancers, right? And that's a tall order. I've been working on that for a long time, and that's always part of my mission. But it was also very clear that there was some low hanging fruit here in trying to improve the psychosocial health of these patients. And we know that when the psychosocial health is improved, their mental state is improved. When their mental state is improved, their ability to comply with outpatient medications improve, and that improves survival. And so in order to do that, we try to get together some support groups. And me being a bit naive, I said, we'll bring them back to the clinic after hours. We'll have these support groups. We can have them talk while they're getting their chemotherapy infusions, and it'll be great. It'll be easy. And my social worker at the time, Amanda Garbatini, who is just the heart and soul of our program. She is a 5-time cancer survivor herself. She looked at me. She said, "They're not going to come back. They don't want to be here. They don't want to, sit around in a circle with a bunch of other kids with cancer and talk about their cancer. They want to talk to each other, and they want to connect in some way." And so we started looking for solutions. And this was back in 2017, 2018. And at that time, Zoom was kind of a new thing. We thought that would be kind of cool. We talked about having meetups outside the hospital. No one really wanted to show up for that. We talked about just telephone calls and conference calls. And, these weren't really appealing to our patients when we talked to them. And then VR started coming about. And then, Google Cardboard was a big thing. I think Google Cardboard was the first time that we said, this is something that's very quickly going to be affordable and accessible. And that's when we started thinking about what was coming and preparing for that, and getting protocols in order and getting studies in order, and talking to the people around the hospital and trying to find some funding to put together support groups for when this, finally came about. And then the Oculus Quest dropped, and the timing was perfect. And we were able to give headsets out to patients, and we organized these groups. And these groups were 4 patients at a time with Amanda at the center. And we ran 4 groups with 4 patients each, and they each met 6 times. So we ended up having a pretty decent amount of data. And what we showed with that is that when we're trying to put support groups together in person, we had a literal 0% attendance rate. They just did not show up. So it was pretty easy number to beat. And by the time we were done the pilot, we showed a 80% attendance rate, 70% retention rate, which is phenomenal. So it's not that the VR itself was a solution. The VR was a tool to bring these patients together, which is something that we couldn't do before. And so unlike Kim's work, mine was much easier. Kim had to make the magic happen. I just had to bring the patients together. And there were challenges. We had to get patients oriented to the headset. We had to get their headsets charged the night before. We had to remind them to come to the group. We had headsets that we had to get hooked up in a hospital environment. Kim had to do it in the school. We had to do it in the hospital. And we had networks in the hospital that were locked down. They did not like peer-to-peer connections, and that's what we needed for HIPAA compliance and safety compliance and privacy. So we were bringing in hotspots to the hospital. And so there were all these things we had to work around to get this working in different environments and make it reliable. But we finally did it. And so beyond there, we started introducing this to other populations. We're now running these groups with slightly older young adults. So we're working with these in the metastatic breast and GI cancer populations. We want to see some improvements in anxiety and depression. We've already shown improvements in resilience in our younger populations. We want to reiterate that in the older population. And, like Kim, we're trying to get some NIH funding to bring this national, bring this to populations throughout the country that are, for one reason or another, underserved, whether that's because they live in rural areas or they are socioeconomically disadvantaged. But we want to reach these populations and get them involved in these support groups as well. And then the other group that we brought this to at Yale is through our Yale Gender Clinic. So these are LGBTQ plus youth, transgendered youth, who may not feel comfortable in their own bodies. And so we're offering them the opportunity to design avatars in the way that they feel most comfortable. We're even allowing some voice modulation, and it has been so exciting. And that's probably been the most thrilling part about this. It's kind of found, this population that is really loving these technologies and really finding their way by using them. And so we're looking to expand that as well. But it's been a journey. It's been super exciting as the technology becomes, less expensive, more accessible, more people are used to it, the more I think this is going to spread. And we're really excited to continue the research and spread around the country into different populations that can really benefit from it.
Wow, amazing. That's so exciting. I think it's really exciting to see all the different advantages of becoming an avatar and engaging in the social space, from folks who are experiencing cancer to folks who are LGBT as well and transgender and really, not necessarily experiencing that information out in the real world in those social situations. And all of a sudden to experience that belonging and sense of connection is just such a beautiful thing. And, to be able to facilitate that, I think is really, really exciting. I'm curious, how did you kind of design the intervention itself in terms of what they're talking about, facilitating, do you have therapists on the platforms and things like that? How are you kind of facilitating those groups?
Yeah, so the way that we're doing it is that Amanda, our social worker, is actually present at all the groups. She facilitates the groups. What we're looking at a little bit more is more of an Innerworld model, to be honest. The peer-to-peer model seems to be something that's also of great interest. And so we're looking to do that in ways that are safe and effective, and you guys have definitely kind of figured that out. One challenge for us is the cost that entails doing it in kind of a clinical medical setting. Right now there aren't necessarily models in place for reimbursement, so we do have to make sure that our social workers get reimbursed. Our clinicians get reimbursed, but again, that peer-to-peer model may be able to be our solution. So we're excited about exploring that a little bit more. The platform that we used is called Foretell Reality, which is one that does have that HIPAA compliance that we require for an actual clinical study. We couldn't get it through the IRB without it. And it's a little bit more closed off, but it's one that worked at the time, and I think it's going to be interesting to look at that version versus the more peer-to-peer model. We're excited to explore both.
Yeah, you could even do some groups in Innerworld in the future.
That's what we're looking at.
Yeah, we have our adolescent version of Innerworld, as folks know, and I think also building that community. Imagine
Absolutely.
a 24/7 community for oncology patients. Where they could come in at any time, and there's always someone here. And then also, I think the interesting thing about Innerworld is the transdiagnostic element of our community, which means people, someone who has cancer and is battling that and surviving, maybe they need to go to like a anxiety meeting or a workplace stress meeting, or they're dealing with other everyday issues as well. And so I think sometimes it's interesting because interventions can be designed for a specific purpose, but then we end up seeing folks with all sorts of different backgrounds, or utilizing something that we wouldn't expect in things. So it's really interesting. But I think your work is really, really exciting and really impactful as well, and important for helping children. I just want everyone here to know is that I didn't realize this until I started getting into research and IRB and all that kind of stuff, that what Kim and Asher are doing with children and adolescents under the age of 18, getting approval from a university medical center to have them going into experimental interventions, all of the safety and the regulation and the protocols, it's really hard and it takes a
Yeah.
long time and persistence. And I think they've had, review boards to reject what they're doing over and over and over again. And, so I think it's really awesome to highlight, how persistent both of you have been in actually getting these things through so that you can be helping children. The irony is that children need so much help and there's so much red tape around helping them and
Yeah.
developing new interventions. So I think you guys are doing a
Absolutely.
really great job with that.
Yeah, I think to put it in perspective, I sat on the protocol review committee that actually reviewed this when we first presented it, and it was a committee within the cancer hospital. And it was a committee where we often saw kind of phase 1 therapeutics come through, and those therapeutics would come through, past at the first meeting. It would take 45 minutes. My protocol took 9 months just because it was something that the committee just wasn't used to. So we were really kind of pioneering and figuring out what safety things we had to worry about. And it was a tremendously helpful experience to kind of force us to think about, what happens when a patient disconnects. Is that a tech issue? Is that an emotional issue? How do you connect with them afterwards? How do you get them back engaged? How do you manage things like perhaps motion sickness and a lot of things that we didn't think about at first. It really was helpful to go through that rigor and say, we can do this confidently, we can do this safety, and we can get some good results out of it.
Amazing. Well, thank you for sharing. And I'm curious if anyone has any questions for Asher before we move to the third part. We can take a few questions now. Yeah, Red Eyed.
Yeah, you mentioned rural. That hit my heart because I'm rural.
Yeah.
And children, they hit my heart. That's very, very important that you're working with kids with cancer. And one of my questions to you is, I'm wondering how this works with the HEPA laws. That's one, and the other thing is the insurances, because
Yeah.
I don't think insurance necessarily, wants to cover anything half the time. No offense to the insurance companies, but
Yeah.
how do you get around that piece of it, especially if you're dealing with VR?
Yeah, no, those are I'd say the two biggest questions. The HIPAA question is basically we had to find a company willing to sign off on a business agreement and say we are HIPAA compliant. We can guarantee these peer-to-peer end-to-end connections that are safe and HIPAA compliant. So that really took, quite frankly, some bravery on Fortality's part to say we can ensure the HIPAA compliance. And then the question about billing, that's one that we're still looking at. So I was unable to launch a clinical trial and say, we're going to bill for it and we may or may not get reimbursed. And if we don't, the hospital's going to bill you. So the next step of this is going to be to try to launch these in a more clinical way, where the research question isn't going to be, is this effective? The research question is going to be, can we get reimbursed for this? And we've talked to our reimbursement department quite a bit. And I think, there are really two ways. One, with any technology, is to get FDA approval. And frankly, I don't view the VR as the intervention. So I don't think that FDA approval is what we're looking for. What we're looking for is a way to say that we are delivering a service that we would deliver otherwise. We're just using a technology to do it. So the billing codes we're looking at are more around the fact that we are running support groups. And so we would bill as if it was a patient attending a support group. And so that's what we're going to try. I think as the technology progresses, the access to the technology is going to come down and that'll become less of an issue. And we'll just have to, ensure reimbursement for our social workers and psychologists, anyone who's delivering the intervention through the tool itself.
Fantastic. Yeah, great question. Thank you, Asher. Eva.
Yeah, I hear what you're saying around the tool, and it's still, there's a way that we're doing this treatment, and yet earlier, as you were saying, there's this unique dimension to it, as in the way we're interacting as avatars. And for a lot of people with mental health issues, this is a huge part of why this works, whereas some live face-to-face things might not work, right? And so where I'm wondering about, and I don't know if this is where you guys are going, or maybe you've already considered it, but it's a big thing, is around education, especially with those kids, like you say, that are in hospital or whatever, and, can't go to school for whatever reason. So, we've seen big changes in education recently, and I'm back in school myself, and I'm doing a lot of digital online learning. And that this is changing education hugely. And I'm starting to wonder about the potentials of this type of platform from an education standpoint, and how we could even potentially start having apps where teachers are using it to deliver curricula, just in the basic levels of education that we need.
Yeah, no, it's a great question, and in fact, one of the first things that really inspired me to get involved in VR, in the book Ready Player One, they describe a situation where kids are kind of dispersed throughout this post-apocalyptic, hellscape, but they're attending class in VR. And to me, I started thinking about our kids that are stuck in the hospital, our kids that are in rural areas, and I think this hit even closer to home once COVID came. And right now there are solutions where kids can attend class, whether it be Zoom. Some of our kids in the hospital will attend via a camera. There's some really cool experimental innovations where it's kind of a kid there's a robot with an iPad attached, and the kids kind of FaceTime through that, and they can actually move for school. What I find really interesting about the VR solution is if the whole classroom's joining via VR, you do have those opportunities for play and for
Yes.
virtual interaction. And as a pediatrician, when our kids can't go to school, my concern is not that they're not going to get the curriculum. They can get the curriculum. There are ways to get the curriculum. There are plenty of kids that are homeschooled, but they're missing out on those social interactions. So I get really excited about that opportunity for them to interact in a social way through VR and have those simulated interactions. And the work that Kim and I are interested in doing is seeing, is that enough? Can we make a difference that way? And this goes back to my, something I kind of brought up a little bit in the beginning. I don't think VR is ever it's never the best choice. I say never now, and that may change. Right now, I don't think it's the best choice, but it's better than nothing, and it's way better than I think a lot of the situations that we're seeing.
Yeah, because
Interesting.
that's what I'm missing in my digital online learning right now, is that social interaction.
Yes.
Yeah,
Yeah, absolutely.
interesting.
I
Yeah,
do
thank you,
want to
Eva.
add in that
Yeah.
Meta has funded and it's in development now. I don't know if it's complete, but the first virtual campus, like
Mhm.
university campus, and that's completely all in VR. I've seen like the actual like structure of it. I don't know if it's up and running, but I've seen like the actual, the buildings in VR and whatnot. So that idea is not too far off. I think we're getting there. Meta's working, funding a group to create that, an online university. So it doesn't work for kids that are in school, right? That are maybe missing school for other reasons, but it's a start.
That's
Yes.
awesome. Thank you.
Yeah. We only have time for Toji. Two more questions. I think Toji and Joker have had their hands up for 4 minutes now. And then Dharma and Gabriel, if you hold your questions towards, we have one more topic to get to, and then we can take additional questions then. So, Toji, do you want to go?
Yeah, you originally talked about how the hospital was kind of like hesitant of what you were doing. My question was, what were the parents like? Were the parents hesitant, or
Mhm.
were they like, how is this gonna help? That was my
Yeah,
question. Thank you.
we actually got tremendous feedback from the parents, to the point that one of the follow-up studies we were looking at was to actually bring parents into support groups, because that's something that we hear about all the time. That when we talk about treating a child with cancer, I actually talk about treating the family. It is tremendously traumatic for parents, for siblings, not only emotionally but financially. So these families are going through a lot. And so the parents were really enthusiastic. We got great feedback about the care that their kids were receiving. And I think that the strongest compliment was that they wanted groups for themselves.
Interesting. Well, I know a platform where adults can come in and get support with each other, but yeah. But yeah, that's really cool. I think that would be really powerful. Again, that idea of like one device in a home can all of a sudden be an intervention for the entire family, which I think is really exciting. And then lastly, before we get to our last topic, Joker.
Okay, so we asked the question, what defines a child? 18, 25, okay, it doesn't matter, but we're talking about content. And we're offering them VR, which opens up a whole nother world outside mental health, which I've seen already that it can be great use for that, yes. But how do we keep them safe in the other worlds where, there's a suicide pandemic going on, and we hear kids in other worlds where, oh, just go kill yourself, And I'll step up, and my wife steps up, says, hey, don't be talking like that. There's serious stuff. How do we keep these kids safe? I mean, a birthday is just simply changing a couple numbers at the end of your year. I mean, where does that go from there?
That's a great question. I'll let you guys respond, and then that's actually a perfect segue into our third topic about ethics and reality and how children are affected by that. So, yeah, you guys want to respond to that question, and then we can get into our last topic. I think that's a fantastic question, Joker. Thank you.
Yeah, it's a huge concern for us, and it's interesting. We speak at industry conferences and we speak at academic conferences. And at the industry conferences, we're kind of the prudes, and at the academic conferences, we're crazy. So I think we're doing something right.
Wow.
And I think the way that we see it is that it's a balance, right? Any tool can be used for good. Any tool can be used for bad. I think that we are in agreement that social media has been a mess. That people did not society, that was making the rules. We didn't see social media for the harm that it could do. We didn't see the power in it. And we're at a place right now where we are recognizing the power in VR and XR. And I think it brings the benefit and the downsides of social media to another level because of the immersion. And so I wish I had an answer, but I think it's something that we as a society need to look at together. I think policy needs to be put in place sooner rather than later. And I think that we need to keep an eye on our kids, right? When they're using social media, at least it's on a phone you can grab and look at. It's on a computer screen you can take a peek at. When they're in a headset, you got no idea what's going on there. So it's even more urgent and even more concerning. So we're with you.
Wow. Yeah, I think it's really important. And that's, partly why Innerworld's adolescent version, has so much supervision as well. So I think it's really important. And I guess that kind of brings us to our final topic. And Harley, we can come back to your question towards the end. We have time. So I was talking to Kim and Asher about a really interesting topic that they brought up. And I think are exploring through research this question of what, children have to imagine things, and they have imaginary friends, and they have different kinds of situations where they might think something is real when it's not, like monsters under the bed. And so this question of how do virtual experiences, and even what Joker was talking about, a child going into a situation where someone violates their personal space or has an experience, how do they experience those virtual or not real, as we call it, events? I'm curious if both of you could maybe talk about your thoughts on this really important and interesting question.
You're up, Ken.
Yeah, no, sure. So kids, when we think about development, right? We know kids develop kind of quickly, but they're not kids and then they become adults, right? There's a lot of gray area in there, and in a lot of ways, their cognitive development in terms of their abilities to kind of understand people and relationships and themselves, critical thinking skills. But one big one is their ability to establish the difference between reality and fantasy. And this is why young kids, right, up to can you guys remember the age when you for those that believed in Santa, when you stopped believing in Santa? It was probably around the age 8 or 9, maybe, right? But
Yeah,
before
10.
those 10, yeah, so 10, around that age. So young kids, they really have a difficult time distinguish between reality and fantasy. So, and we all know the power of VR when we put a headset on, we can feel like we're in a different environment. We think we have a very hard time distinguishing what, as a child, maybe what's real in VR and what's real in life, especially when we have parents that are saying Santa's real, so Tooth Fairy's real, Easter Bunny's real. Kids just have a really hard time grasping that. And they do eventually figure it out. And they move from this kind of very concrete thinking to more abstract thinking as teenagers. But there's just this there's quite a long times when kids are just not thinking like adults, and that's great. That's who they are. But it does mean that they're very, very, very vulnerable. They're also, in terms of psychosocial, in terms of like their relationships with people. This is why kids, unfortunately, can get taken advantage of in many, many ways, right? Can get trafficked, maybe, perhaps, or adults can kind of lure them in and pretend to be children, or figure out how to get them to trust them and give them their phone numbers and whatnot. Kids just don't understand that there are mean people out there trying to take advantage of them in a certain way. And so we have that responsibility too. So when kids are openly talking to people, like in a space like this, as far as they know, you're all people I can trust, right? And yeah, and so we have to be thoughtful about that. Their psychosocial development, their ability to maintain relationships and form relationships, and around trust and not trusting people. So we have like a lot to think about when we're putting kids in headsets. And so that's why like I was saying, we're really cautious about when we think a child could benefit from being in VR. And again, it's mostly related to content versus the hardware. We can create hardware that fits little kids' faces, but is that necessarily a good idea? Do we want 6-year-olds in VR? Probably not.
Hmm. Interesting. And yeah, Asher, anything to add there in terms of what you guys are interested? Maybe you could talk about like, okay, what do we go from here as well? Like, what do we do now that we have this question?
Yeah, I mean, I think one of the things that Kim and I are pushing towards, again, it's that balance. We know that this technology can do tremendous good. We know it can do tremendous bad. And when we study kind of chemotherapy is how I always compare it, right? Chemotherapy can kill at the wrong doses, at the highest doses. And we're always treading that line of what is the highest tolerated dose to kill the cancer. Well, right now, I think we're at a place with VR and immersive technologies in kids where it's actually the opposite. Something that we're interested in is what's kind of the lowest dose of immersion that's going to give us the benefits that we've seen with VR. And so we're kind of looking at things like, isolated spatial audio. And then, what does it mean when we start bringing in augmented reality? What happens when we, take someone that's not there and put them in a child's, normal environment? It's even more confusing in terms of what it's not. So we're trying to be very cognizant of not forming these false memories, which are very easy to do. There's some old literature that shows it, and that's the kind of thing that we want to kind of recapitulate in the lab. How easy is it to create false memories, and what does that mean for a child's development? What does that mean when there's a crime that takes place in VR, a quote virtual crime? Well, it has real consequences on someone's emotions. It may not be physical, but it's mental, it's real. So these are kind of the big questions that we want to address. They're, and I think you'll see we've talked about a lot of the work we do. A lot of it's pretty kind of obvious work, and this is the stuff that we think really needs to be done in the long term to figure out what do these technologies mean as a whole.
Interesting. Yeah, thank you for sharing. I think Kim's headset might have died because I think she was maybe plugging it into charge. I could see. But I think she'll be back maybe on desktop. Yeah, and Dharma, we'll get to your question in a second. If folks have other questions, we're going to kind of open it up now to questions. And I just want to mention as well that, I think another example of this is exposure therapy. There's research that shows that exposure therapy is as effective as real life exposure for different phobias like flying or other kinds of things like that. And if it's as effective, it means that those experiences feel very real to people. And so, what is a false memory? Is it a real memory? Because it's a real neurobiological response to the stimulus. And then lastly, I'll just mention that people think some theories of consciousness propose that we basically create virtual reality in reality, that our brain is basically, taking input of all these different sources of stimuli and basically creating a reality around us, just like we do when we put on the headset. And so, yeah, I think this question is like, what is a false memory? What is reality? It's so cool that, you guys are both exploring these important questions and its impact on mental health and child well-being.
Yeah, there's actually a great book called Reality Plus by a professor out of NYU. I can know his first name. His last name is Chalmers, Chalmers, and it's the big kind of philosophical questions of reality and how that applies to virtual reality. And just like you said, Noah, every memory is a false memory, right? Our memories are made up in our minds, and there's some great studies about nostalgia and what is nostalgia and where does that come from. So these are the again, these are the big questions that Kim and I love to geek out on. But it's important that we also kind of approach them from a scientific perspective and try to find some answers.
Amazing.
There's one thing I just noticed, like this is such a great little social experiment here, but if you just look around at everybody in the crowd up here, how all of you chose to kind of put like your own circle around each other and like not in getting too close to each other, kind of make sure you all had space, even though you're virtual, right? Like we all like there's still a lot of those same rules that we have in reality, right? That we feel we need in VR. Because could you imagine if somebody was standing like really close to you, how uncomfortable that might make you feel, even though it's virtual and it's not real, right? It feels really real, and that can be powerful.
Totally. Yeah, it's really, really interesting. We could do a whole session on just this topic. I think it's really fascinating. Yeah, we'll have about 15 minutes left. And Dharma, thank you for your patience. We can go to you and anyone else who have questions in our remaining 15 minutes of the rest of this expert panel. So Dharma, would you like to go next?
Okay, just to create context, I want to express my gratitude for how much coming here has helped me. I am not in any kind of pain like what I was in when I first came here. And I'm 74, and I just thumbs up and thanks a million for all that. When I bought my MetaQuest, I actually sat down and read the instructions because it was such a different thing for me. In the instructions, there's actually warnings for children not to use it, that it can be damaging to their hand-eye coordination. I mean, in the booklet that came with it, and it's in bold letters. It's written in bold, the warnings about the negative effect this can have on children and younger people. Okay, that's what I wanted to say. And maybe I misread it, and you guys know more than I do. But I was going to get one for my grandson, and then I didn't because of what it said.
Yeah,
No,
I'm curious if you guys can speak to that.
Yeah. No, that's such a great catch, right? And there's a lot of politics behind this and industry trying to like keep themselves from not getting sued. A lot of this has to do with we just don't know yet. We don't know. Like there's VR, AR, kind of this kind of ability to, use these kind of headsets with kids. It's relatively new. Kids have not been in headsets like this more in like a social public way and ever. So a lot of that is just them protecting themselves. And Asher can talk about why it's usually 13 and up, which has nothing to do with kids like age and their development at all. I have not seen anything, just to let you know, I've not seen anything related to hand-eye coordination. In fact, we often see like the VR being used for physical and occupational therapy with kids to actually increase their motor skills, fine motor and gross motor skills. So I'd be really surprised by that. I mean, I wouldn't be surprised if it's written in there, but I can't say that there has been any research yet that has proven or disproven that. So, Asher?
Thank you.
Yeah, no, it's in there because we don't know, and as Kim was saying, they're covering themselves. We're in the process right now of doing a scope and review, which means we're looking at every piece of literature ever published about kids in VR and its health uses in healthcare settings and for health education is actually a lot of these that fall into what we're looking at. But there's almost nothing out there about the physical effects. There have been statements actually from the American Association of Ophthalmology saying that they really don't have many concerns about vision, which is something that comes up a lot. There's some small short-term concerns about vision, but there doesn't seem to be any good data on long-term. The reason that a lot of the headsets say 13 and above comes from a law written in 1996 called COPPA, C-O-P-P-A. And this was a law put in place more about preventing the access of information that children children's information in an online setting. So if you look at some of the earlier headsets that did not have access to the internet, the age was actually lower. So this is more coming from that than anything else. That being said, don't go home and say, Dr. Mark said it's okay to put my 6-year-old in a headset. The truth is we don't know. And so we've got to pick a conservative number. A conservative number of 13, I think, is a nice one. It's going down to 10 from Meta, which I think also has some I think it's a decent number. But the bottom line is the research just isn't there. And that's one of the reasons that we do what we do. And one of the reasons that we are starting to look at this more from what is the minimally required exposure to an immersive environment versus the maximally required exposure.
That all makes sense. Thank you.
Of course.
Great. Yeah, Saspar.
Hi. So I just want to say that I'm 47. I've never been on a VR in my life. It was actually something that was gifted to my 13-year-old for Christmas. They ended up not really being interested, so I was like, you know what, let me try it out. Well, like a month later, here I am.
Welcome.
I decided to really just kind of look and see what the pros and the cons were, because I knew there were going to be cons, but I wanted to see what the pros were. And I'm a person that focuses on a lot of meditation and stuff like that. And I came into Innerworld, and I've got to say that I'm very happy with it. It's been a phenomenal experience for me. I mean, just great things have happened for me in such a short while. So I'm just excited to see what the long term is going to bring. And just listening to both of you talk about what you're trying to do for these families and children is just absolutely amazing to me. Because when I got into Innerworld, the first thing I thought of was when my kids were shut down for COVID and everything was online. And one of my kids did have a negative effect to it. And it's something that we've had to work for, just helping through therapy the last couple of years. And I'm encouraging them to go into the inner world for the youth, and just trying to convince them that it's a safe place and stuff. So I'm just really excited to see how VR is going to turn out in the future, especially for the kids growing up. I think it's going to be a big benefit.
Amazing. Thank you for sharing. And also, if you're able to leave a review on you can leave a review for Innerworld by opening the MetaQuest app on your phone and searching for Innerworld. And if anyone hasn't done that, that's a huge help to us to show Meta, and other people what Innerworld is all about. Yeah, thank you for sharing, Saspar. Joker.
Yeah. So, I just want to add to Dham over there. We have younger kids under age 13, and we just limit them to like 30 minutes at a time. I agree that the VR is helping with hand-eye coordination and helping improve that. And would the suggestion come down to, like here in Innerworld, we always have a guide or somebody here we can talk to. Would it come down to the game designers to put someone in the rooms to moderate, to help with children?
Yeah, I think so. Yeah, Kim.
Yeah. No, I think that's an interesting. They definitely kids need different kinds of support, right? And yeah, that's a good idea.
Yeah, I think, and that's what we're doing in Innerworld too. Like, there's always a guide present when they interact. Yeah, so I think it's a great suggestion. We do only have a few more minutes, so I think just the hands that are raised we'll get to, and then we'll wrap up. So Toji, Red Eyed, and then Gabriel to wrap things up. So yeah, Toji.
Yeah, I just want to say thank you for this meeting, and it was really informative, and I learned a lot. And so I'm 19, and I first used VR when I was 11. I used like one of the like screen VRs for like the phone. You put the phone in, and then I got like my first real VR when I was like I think like 13. And I definitely understand the not knowing what's real and fake, like not knowing what real like concepts are. Because I grew up for a long time using the VR, and then as a child, I was very like confused. Like I didn't understand,
Hmm.
I guess, what was really going on. Like, because there was things I'd seen on the VR that I was like, this isn't like real life. Like, what's going on? Like, what's happening? And I did do therapy for a long time with VR with a therapist as like growing up like 16, 17, and it kind of like it definitely was weird as a child having a VR, but as growing up and being older, it definitely like changed my like sense of like reality a little bit. But I mean, it's back to normal now that I've gotten older. So I think I wonder what you guys like see on that. Like how I understand there's not a lot of science or like evidence right now based on that kind of stuff, but I wonder like your guys' perspective on that.
Yeah, there's like one kind of little thing I'll throw out there that's kind of cool. Um, for some people, if they spend a lot of time in VR and then take their VR headset off, they kind of start to dissociate where they can't tell. Like they'll look down and they'll expect to see their VR hands, right? Or look around and see some like something that should be happening in VR. Or happening, yeah, in real life, and it's kind of that translating over from VR, and it's a little bit of a dissociation, which is really, we're really fascinated with this idea of just kind of better understanding how we can kind of move between two worlds and how our brain can be tricked enough to kind of be confused in some ways that we even step out of VR and in the real world see aspects of our virtual world. So that's pretty amazing. Um, the second thing I just want to say that I feel like as 19, like that's just, you've already got more experience than most people. It's going to be your generation that is, I think, Asher and I, we grew up differently, right? We didn't have this. We didn't have cell phones until college, right? Like it's just a different, you're going to look at the world differently, and you're going to impact the world differently because of the way that you're experiencing the world now, which includes virtual worlds. And I'm just fascinated and excited to see how you how you view the world differently because of this as you grow up into adulthood. I think you're going to be the one that's going to be making the changes, right? In the terms of, yeah, VR is great. It's simple, easy. Jump in it. Like here's some solutions. It's a lot harder for older generations, I think. So that's awesome.
Interesting. Yeah, thank you for sharing, Doji. And yeah, I think it'd be interesting, Kim and Asher, at some point as part of your research to interview folks who, have been using VR for a long time. And I think that'd be really interesting to. I mean, I tell you, your experiences are really interesting and kind of map onto some of the things Kim and Asher have been talking about. So I think it's really, really fascinating. Thank you for sharing. Red Eyed.
Yes, and I agree with Toji. I want to thank you guys for being here and taking your time and to share the information. And I've learned being in the inner world, age is irrelevant. It's not about age, sex, and location, which is something when I was first on computer, it was ASL, which is not American Sign Language, which I did take up in college. But age, sex, and location used to be a big thing back in the day. And as you can tell, I'm probably one of the older ones here. And that's okay. I have 24 grandchildren. I want the best for them. And I agree. Toji is one of our future. She's holding on to a piece of this. And I am so grateful that you guys come and shared this information because I have children and grandchildren. They're both using the electrical devices to smoke with. And when I tried to quit smoking with them, things were worse. So I'm glad that you're taking that into consideration, the cancer as well with people. That's hand in hand. But I did want to share this really quickly with you. Back in my day, I remember when our parents would say things like, get away from the TV, you're sitting too close to it, you're going to ruin your eyes. And now we're wearing these devices on our eyes. So I just wanted to share that with you,
So great.
just as a smile, because the bottom line is I've been using this for 2 years. Innerworld has been the best thing for me. I mean, I used to wear my emotions on my sleeve. And now I'm learning how to let my emotions, to regulate my emotions, to be okay with who I am. And that is something that this gives me here. And you're never too old or too young to learn something new. So I just want to thank you all. And no, you already know how I feel about you, but I'm just grateful that we have this type of programming so that the future, my grandchildren, will someday, or perhaps my great grandchildren, will someday get information from Toji and people like yourselves from Yale and everywhere else that are willing to work on this and to learn. Because so far, I can see just fine when I take my headset off. And I thank you guys for being here.
Oh, thank you, Red Eye. Yeah.
Thank you.
Thank
Yeah,
you.
Gabriel. You are muted, so you need to open your quick menu and then point at the bottom left icon, the microphone icon. That was the push to talk, and then there's another icon that's to the left of that. Yep.
Oh,
there you go.
sorry. I couldn't see it because of my Oculus controllers. But yes, hi there. Thank you for this seminar. It was very interesting. I guess I just wanted to ask about a few things. When you guys were talking about like using VR for like education, I was just wondering if you guys saw about the news recently about a Japanese international high school. I think it's called UC that made like a VTuber VR high school where like kids can use that to like get their high school education.
Yeah, I don't think we've
I've
heard of
not
that.
seen that. No.
I have
But
not,
that's
but I think that is
check it out. Yeah.
so wonderful that there needs to be better options for kids that hate going to high school and really, really struggle because of social anxiety or depression or other issues. And we don't have a lot of options for those kids aside from being homeschooled, which just kind of adds to the layers of feeling different. But having options like VR schools or ways to do it in other ways, I just think that's wonderful. I'll have to look into that. I've not heard about this. That's really cool.
Yeah, and then I
Yeah.
guess another question. Just so another question I wanted to ask is when you guys are talking about autism and like how you're going to use it as a social intervention, not intervention, but using it as a way to teach kids social coping skills. Have you guys ever thought about like using AI? I don't remember which platform it was, but there's this VR platform I saw recently. It was mostly for role playing, but they had like AI bots in servers so that people didn't feel like so isolated, even though the platform wasn't as populated. And I was just wondering, have you guys like looked into like using ChatGPT as a way for like kids to practice their social interaction and develop those type of skills?
Go
Well,
for it,
I can
Asher.
say, yeah, I can say we're just starting to get into AI now. Actually, in the lab, I was just working on a custom GPT to act as a patient navigator for our oncology patients. So I think the toughest thing about AI, Kim and I were talking today, is it changes every week. We're both spending hours every week trying to keep up. But I think AI to practice those social skills is a remarkable idea. I know that people are thinking about it. One use case that I keep thinking about is to teach medical students to give bad news. But if we can do that, then I think autism's an easy one that we can use to help folks practice. So
Yeah.
we've thought about it again. I think this is one we're going to leave to the autism experts, but the technology's there, and I think combining AI with VR is something that really appeals to us.
Yeah, it embodies the AI into a entity, and so it's really interesting. We're exploring that as well, and I think it's really exciting. We do have to wrap up now. We have hit the hour, and so I want to thank everyone for coming to this event, viewers as well on YouTube, and also thank you to Liron, who's on our team and actually recording this whole thing. So thank you so much for being here as well to record that, and thanks for our audience and thanks for our guests as well. Asher and Kim, you're doing incredible work, and just really appreciate your time and attention today. So thank you.
Thanks for having us.
Thank you for having us.
Thank you. Yeah.
And
Thank
Kim and
you.
Asher, I'll just bring you into a world of debrief and wrap up here. So I want to thank everyone here, and I hope everyone has a good evening. Thank you all for coming and for the incredible questions that you were asking too.
Thank you.
Thank you.
Thank
Thank
you.
you
guys.
so much.
Hi,
That was
everyone.
awesome.
Thank you.
Thank you.
Thank you so much.
Thank you.
Take care, everyone. Thank you
Thanks,
all.
Noah.